Thank you very much, and it's great to be here, and it's a privilege to be part of this conference. I haven't joined an NACCW conference before, and it's quite a while since I've been in South Africa. So although I'm only with you virtually, it's a thrill to be connected with such wonderful South African colleagues again, and I'm learning a lot about child and youth care workers. Since I've joined this alliance as the Global Social Service Workforce Alliance, we have been connecting with child and youth care workers in South Africa and Canada and a few other places. So it's great to have you collaborating with us globally, and it's wonderful to be able to support your work here in South Africa as well. So I'll just share my screen initially to go through these slides, and then I'm happy to answer questions as mentioned earlier. So thanks very much for that introduction. Okay, that's great. Sorry for the slight delay there. Okay, so this is a presentation that I'm going to make about our annual State of the Social Service Workforce Report. And the title is, as mentioned, about responding, adapting, and innovating during the pandemic. So just to give you a little bit of background about the Global Social Service Workforce Alliance, we have about 3,000 members worldwide. In fact, we were started, I think, out of a conference in Cape Town in 2010, and then it took a few years to come up with the idea of an overall alliance. There was a perceived need to really strengthen the workforce, as well as just strengthening child protection sector and the sector working with orphans and vulnerable children in sub-Saharan Africa. So UNICEF and USAID and a number of other donors and international NGOs and governments came together at that conference to come up with the idea of for the alliance, and it's been growing from strength to strength ever since. You can see on this slide that we've produced an annual State of the Social Service Workforce Report for a number of years in the past, since 2015. But understandably, when it came, and all of these are available on our website, each one has a slightly different theme. But when it came to 2020, it was apparent that the overriding theme was going to be the pandemic. And so we had to think what was the best particular focus, and also when would be a good time to write this report, because clearly things were changing so much that we could hardly draw a line under the pandemic and say, right, okay, now we can look back and reflect on how the pandemic affected people, because it was still very much affecting people as we were writing. So it's not an ideal way. You can't, it's too soon to write any history of the pandemic, and it's really just an analysis of some of the experiences that the workforce have had. Plus, it's been backed up. So we had a survey that went out to members worldwide, both at the beginning of the pandemic and again in April of this year. So we were able to make comparisons between the survey, about a year's gap in between those two surveys. And this just mentions where you can download that report. So this map shows the range of respondents. So quite a few came from Eastern and Southern Africa, from your regions. In fact, that was the most well represented, 95 respondents across 7 countries. But you can see there's a wide range of others represented from other parts of Africa, from South Asia, from Europe and Central Asia, where I'm located, and from North America and Central America. So it's a reasonably wide range of respondents to our survey, but of course, people have been extremely busy and quite stressed out during the pandemic, not always able to answer surveys, and often really this has not been everybody's priority. So we acknowledge that it perhaps, you know, a lot of people that could have responded were really not able to find time to do so, particularly the second survey when it came out just earlier this year. But we also carried out research on the literature on a range of reports. There's been a very wide range of reports have come out on the impact of the pandemic. So we are really trying to capture that information as well in our State of the Social Service Workforce Report. So some of the main conclusions that we've found are that, of course, that the social service workforce has played a wide range of essential roles. And this is very much in line with the essential roles that, you know, for a number of years, we have proposed that the essential, that the workforce needs to fulfill. So that generally speaking, in most countries, the workforce is operating at multiple levels. It's working locally with individuals, with communities, and with the wider society. And in doing so, it has a preventive role, a responsive role, responding to individual cases, individual problems that people have, and a promotive role, which is another way of saying promoting awareness, discussing issues more widely, and trying to promote the overall workforce and make sure it has the support and resources it needs. So again, during the pandemic, the workforce was very much performing all three of those roles at the local level, at the community level, and at the national level. And it was also clearly providing direct assistance and psychosocial support to individuals, families, and communities, but also more widely was enabling access to services, because it was found that really during the pandemic, some of the most marginalized and vulnerable individuals and communities were even more disadvantaged by the pandemic and even more cut off from services. So it was crucial for the workforce to really try and connect them to the services that were available and make them aware of new ones that were being set up. So it also was involved in supporting children and families, protecting specific children in need, and especially taking into account the effect of school closures, which I'm sure this is the case in South Africa, may well still be the case. A number of countries still have their schools closed. That had a huge impact on children and their families in terms of obviously lack of access to education, but also a lack of access to the psychosocial support provided through schools, and exposure to risk through being left at home or without care for long periods of time. There was also a focus on generally building the resilience of individuals, families, and communities, and providing wider public information and raising awareness about the pandemic and ways to keep safe. In all of that, of course, the workforce itself was very challenged, and the range of challenges it experienced include increase in caseload, greater complexity of cases as well, increased levels of occupational stress and burnout, just not enough staff to cover that increased demand in many cases. In a somewhat positive development, there was an increased recruitment of volunteers, but that was also somewhat risky because by relying on volunteers, particularly at community level, if that is an excessive reliance without backup from professional staff, then it can lead to people being exposed in situations for which they've not been trained and they're not being supervised. So that was a bit of a dilemma, how to, yes, increase the number of people available in the workforce through involving volunteers at the community level, but how to do so safely and without in any way excessively relying on them for tasks that they haven't been sufficiently trained or supported and are not being remunerated. There was also generally a sense that demand was often outstripping resources, and funding was sometimes even cut because the sources of funding was no longer available or was reallocated. There was also a challenge that in some contexts, in fact many initially, the workforce was not deemed essential. And I don't know if that was the case in South Africa. It might be interesting to hear. And so that meant that whilst the medical workforce and the public health workforce were mandated to go out and protect the population, social workers and the child and youth care workers, the social service workforce were left told to stay home during lockdowns and were not given the mandate and the status to go out and not given the equipment to protect them to do so. But where the workforce was classified as essential, they were given new responsibilities to support larger efforts to respond to the pandemic. And that included community awareness and contact tracing. And even in Wuhan in China, where it first started, the social service workforce very quickly had a role there in responding. And others then followed that example. Many organizations had to, of course, shift their way of providing services from direct in-person delivery to remote delivery. And they did so often without having prior experience or training in that kind of delivery. So sometimes there was a bit of a break in service, and the initial service was not particularly effective, and there wasn't appropriate case management. In some contexts, while they were trying to use technology, there wasn't really the electricity or the internet or the devices to do so reliably. And that meant that several groups were particularly affected, those who lack the equipment, the ability, or the confidence using technological devices, particularly people with learning difficulties, with visual impairments, older people, and just people who are economically disadvantaged or living in remote areas. All of those groups may have had particular difficulty adapting to accessing services online or via telephone. So just a quote here coming out of Rwanda, just saying that while nurses and doctors were given protective material, like the PPE that is often referred to, no one seemed to care about the social workers and the community workers. Even the support to vulnerable families was very important. It wasn't necessarily considered urgent at the beginning. So how did the workforce then respond to all these challenges? Well, the first thing that they tried to do was to offer continuity, to supporting continuous effective service provision for both workers and clients. So really making sure that managers continue to support workers and workers continue to support clients or beneficiaries. And for that, it was important to choose a communication channel that would work for workers and clients. So whether that was WhatsApp, telephone, Zoom, Skype, whatever, but also oftentimes it was about setting up helplines or reopening or increasing the use of helplines, and then distribution of devices to help isolated people who were going to keep in contact online. Just as education departments were trying to distribute devices and computers for children to remain in touch with their school, so social service workforce were trying to keep their clients and their vulnerable people in touch online if at all possible. But then there were always going to be cases when it was essential to meet somebody in person for a critical assessment, particularly in the case of child protection. And the question was then, if you're going to carry out that kind of a meeting, how can it be done safely? So often it was outdoors or in public spaces where there was ventilation, where there wasn't crowding. But the compromise there was that it's more difficult to interact with someone wearing a mask, and then confidentiality is compromised if you're meeting in a public space. So clearly there were dilemmas there. And there was a lot of task shifting. So the things that people did before may well have changed or transferred to different people. There was upskilling, as people had to learn new skills, such as the use of technology that I've referred to. And then, of course, hiring in new staff and volunteers as well. One example came out of Somalia, with UNICEF supporting a one-week training, which enabled deployment of 235 recent social work graduates to provide services to vulnerable women and children. And I believe there was also an example in Northern Ireland of final year students on social work degrees, rather than having their final year placement, actually then going straight into the workforce in their final year. So prior to actually completing the degree, they were into practice, but they were still supervised. But it would be essentially like starting their job early because the demand was so great. Other case studies that we collected for this report came out of Ethiopia and Kyrgyzstan, where support for older people or people with HIV were continued in different ways, but often using volunteers. And then generally there was a need to collaborate and refer to a wider range of organizations. There were a lot of people and organizations out there that were able to help, but the very important role of the workforce was connecting them all together in referral systems. So that was a crucial way that the workforce responded as well. Another area is around advocacy. So it was very much the case that there was a need to advocate for the workforce. Countries, a wide range of countries are mentioned in our report, but I'm just mentioning here, we have examples from Iran, from the Philippines, from South Africa and Uganda, and that was about raising recognition and support for the workforce as being essential. So that, to allow them to access personal protective equipment, testing in the early stage of the pandemic, and then vaccines later on when they became available. So that was an important element of advocacy to protect the workforce, and then making sure that official policies and guidelines continue to include and reflect the role of the workforce, and that they had particular practice guidelines on how to keep safe. As I understand it, in South Africa, the South African Council for Social Service Professions advocated to government ministries to ensure that properly licensed practitioners were considered essential service providers and could continue meeting the needs of communities. You may enlighten me more about that, but as we understand it, that was a very important piece of advocacy in your context. There was also a call for employers to consider the safety of workers, and that resulted in South Africa in high-level government recognition, as I understand it. So we congratulate you on the advocacy efforts in your country. Elsewhere, the workforce was also responding in terms of supporting workers' health and well-being, and that was particularly crucial. And I've heard it mentioned already in this conference that child and youth care workers need to really think about looking after each other, looking after themselves, because it's very stressful work that we all do. And so in the pandemic, there was a range of virtual training and learning events and advice on self-care, trying to increase the communication to prevent the isolation of staff members in both formal and informal ways, team events and one-to-one, online management and mentoring and supervision, but also self-care techniques such as achieving a work-life balance, rest, recreation, prayer and meditation. Some organizations also provided financial support or other compensation if people were facing increased work, and better personal protective equipment. And another important way to recognize the work that was being done was to give recognition in the media about the work of frontline staff. In a number of countries, like in the UK, where I'm from originally, there was a big event to, once a week to applaud, clap for carers or to applaud for the NHS, the National Health Service. But over time, I think it was recognized that there are other frontline staff that also need to be recognized and applauded publicly in that way. So an example from Portugal is just, the workforce responded by creating information and support lines, and there was a psychological support line for the elderly and providing shopping for isolated people. So there's a whole wide range of ways that the workforce responded and adapted. But now we come to the really interesting part, which is, well, what does this mean for the future? So how many of these innovations and adaptations may well last even once the impact of the pandemic has receded? I think it's quite clear that we will see increased use of online platforms and technology, not just in conferences like this, because we can see that the benefits of a very wide range of participation, but also in service provision, in case management, in child protection conferencing or family group conferencing, in one-to-one or team supervision and training. We'll also probably see more cross-sectoral collaboration around service delivery, building on the relationships that have been formed or strengthened during the pandemic, and hopefully continued flexibility and readiness to adapt, because I think psychological flexibility is a critical requirement for workers to face not just one crisis, but possible future crises. And so I think we'll need to train our workforce and support them to be continually flexible. The future role of the social service organizations will be strengthening not just services, but social protection. And so by that, I mean cash transfers, pensions and benefits, and making sure that they're linked together with the provision of services, sometimes called cash plus care. So the way that social workers and social benefit administrators need to work much more closely hand in hand with each other. I think that's been highlighted in the pandemic, as a lot of families needed emergency payment, a lot of vulnerable individuals needed emergency payments, and that the importance of linking that will be very much part of, I think, the future of service provision. Addressing workers' needs, I think, will remain a focus. I think there's been a more and more focus on mental health and well-being of our staff, thinking about their working conditions. Even as people are working from home or more flexibly, they still need to consider their hours, their work-life balance, and are they receiving sufficient pay for the level and responsibility and stress of the work that they do. I think that advocacy for the social service workforce will continue and will focus particularly on readiness for future pandemics or other humanitarian situations, many of which will probably result from climate change, which of course it will be affecting, is already affecting many of us and will be affecting us more and more in years to come. And we'll need to look at future workforce needs to recruit into the workforce, train, capacity build, and the resources required, and increasingly to get more recognition from our leadership, from our governments, who have tended to overlook the social service workforce for too long, and that may well be the case with the child and youth care workforce in South Africa. So we really need high level recognition in a sustainable long-term way. So a quote here came out of a respondent to our survey from South Africa who said, "The trauma and stress of the social services workforce has been largely ignored. Where addressed, it's fragmented and piecemeal, and it's not located within a risk management strategy." So that's really calling for anticipating risk going ahead and being ready for those risks and having a strategy to manage the likely risks that we'll face in a range of different crises that the workforce may have to respond to, not just at the individual, but also the community and the national level. So the recommendations coming out of our report are quite wide-ranging, and we have recommendations for governments to recognize the workforce as essential, to prioritize access to protective equipment if there are future pandemics. Vaccinations remain critical, and we are lobbying for greater access to vaccinations in all countries. Recognition, support, and policies to enable integration between the full range of social services that the workforce provides. So the coordination that I was talking about. Funding and resources are critical and will remain so to build the capacity of the workforce for future emergencies. And then alongside that is technological infrastructure is very much needed. Organizations and associations of social workers and the wider social service workforce need to also develop guidelines for safe, ethical service delivery, not just during the pandemic, but beyond, to strengthen cross-sectoral collaboration, monitor the well-being of the workforce and the volunteers, offering psychosocial support and making sure that caseloads are not excessive, leveraging and building on the existing technology and making sure it's, continue to refine and improve the way that we do events like this, but also reaching out to clients and families and communities using this kind of technology. We need to be prepared for a rapid surge. So that means a rapid increase in the workforce, in the services that we offer when there is an emergency in future. And that means having stipends for volunteers, training, supervision, opportunities to develop skills. And then to make sure that we document and disseminate that experience, because there's a lot of learning come out of this experience, and we need to share that as widely as possible so that we're all ready for future crises or emergencies of this kind. So that's it essentially. This is again a reminder that the report is available on our website, socialserviceworkforce.org. But at this point, I'd be happy to take any questions if we have any.
Thank you so much for that, Hugh, for that very comprehensive PowerPoint presentation. I'm just looking at the Q&A. At the moment, there aren't any questions as yet. I do invite the audience, if there are any questions to that presentation, please do post it in the Q&A. Then while we give it a minute or two for the audience, I did just have a quick question myself. You did cover it in the presentation, but what were some of the key areas of, let me just show you what were some of the key areas that you think the pandemic really worsened, in which the social service practitioners had to respond? Some of the key areas in which they responded and of need for vulnerable children or youth or families. Mm-hmm. Were there any standout key innovative creative solutions that the social service practitioners came up with during this time?
I think that one of the key things was obviously responding to people's difficult situations of, for example, working parents being at home with children while schools are closed, and that the mental health impact was huge on a number of people. I think that once there was a stage whereby families, communities were locked down, schools were closed, but the cases were not spreading that fast. But when they started to spread fast and there were infections and a high rate of deaths, then I think it reached a very critical phase in terms of the multiple stresses that particularly parents were having to deal with. And then they may have had isolated older people who they couldn't visit or were particularly vulnerable and didn't have their normal social support. And at the same time, if there was a death as a result of COVID, then it was particularly difficult to grieve in the normal way. And that created long-term stress. And probably we will still see the mental health impacts for some years to come. So I think a wide range of impacts in terms of, both social and economic livelihoods, with loss of jobs, closure of schools, loss of many of the community structures, but also mental health in particular. I think that one of the innovations has been the use of social media and general awareness raising on mental health, many of which has been quite positive. I think that there have been a number of countries in which people have listened to young people and children and find out exactly how they're being affected by the pandemic and trying to connect with them in innovative ways. So hotlines and helplines have been important, but they've been around for some time, and often the use of the telephone isn't the way that young people connect. So I think that there are more and more virtual spaces that have been promoted, but we also know that they don't necessarily reach everybody. So I think that there has been quite a bit of innovation in trying to continue to connect with people in person, and to do so safely, and gradually build back into having in-person services as much as possible. But really, you know, such a wide range of innovations that it's hard to summarize them all in one response. I'd urge you to have a look at the report. But I mean, generally, the use of technology is probably the most persistent theme, but also trying to really be responsive to the different situations of different age groups and different types of communities. And also recognizing that some societies became more divided. You know, there was often fear and mistrust of vaccines. Some countries were very, very divided about use of masks. Some countries enabled some people to access services, but others who were already discriminated against faced significant barriers to access, you know, health services, or even to get into areas of town that were suddenly closed to them. So, you know, and public transport was out of bounds for many. So, you know, there were so many different barriers that I think that the role of the workforce in providing community cohesion, in trying to rebuild bridges that were broken, I think that was one of the most important areas.
Thank you. And just one last question. Do you think there is enough research and evidence-based work on collecting data on the role of social service practitioners happening at the moment?
I think there is a little bit been happening, but to be honest, I find it quite very much at the surface, because there's a lot of people in sort of management roles or in research or academic roles whose work has remained largely home-based, and you know, they've been able to continue to do kind of online research. So there's been a lot of desk reviews published, a lot of basically collating what's already out there on the internet. But I think it doesn't really get down to the grassroots. It's been very hard to carry out in-person research, as you can imagine. So I think there's a gap in terms of understanding direct experience of affected individuals, including the workforce themselves. Because as I said at the beginning, some of them are able to respond to online surveys, but some just simply don't have the time. So I think there's a big unanswered question as to, you know, how their work has changed, how it will change in the long run going further. And what are the long-term impacts of the pandemic on individuals and families, particularly as those challenges intersect with other challenges, you know, in terms of, you know, widening social inequalities. So, you know, in many countries, I think racial discrimination and some of the sexual violence, there's been a whole range of issues that have become more apparent, people have become more aware of. But in doing so, trying to understand how these different things intersect and what will be the long-term impact. I think there's definitely a need for definitely more research, absolutely, particularly, as I said, with the direct lived experience of people who've been through this and are continuing to live through a number of challenges as a result of the long-term impacts of the pandemic. Yeah.
All right, well, thank you so much. I see in the Q&A we don't have a question. I think your presentation was comprehensive enough that people are quite happy about the content. But thank you again for the insightful information and for the access to that report. Hopefully we'll ask the organizers to put the report up on the download section for people to access. But thank you.
That would be great.
Thank you for the audience. Yeah.
Okay, all the very best. Okay, thank you. Bye-bye.
Okay, bye.
Bye.